Hi guys, it's Patrick from Fix You Physio in Sligo and Letterkenny. So last week we did a lot of videos on wrist problems, wrist injuries, wrist anatomy and common pathologies that people can get at their wrist. So we've had lots of people messaging us, lots of people calling us, and there's lots of people booked in from last week, this week and next week with wrist injuries, but also elbow injuries. So it's the next joint up. We've had a lot of interest in that. On the back of that, this week's going to be all about elbows. So I'm going to give you a brief introduction to the outside part of your elbow joint today. And this is going to be your elbow joint, as everyone can tell by looking at it. So if I hold it like this, that is going to be the same as me holding my elbow here. So there's going to be my radius, which is this bone here, down to my thumb. And then you're going to have your ulna, which is this bone, coming down to my little finger. So the bone on top is going to be my radius, and the bone on the bottom is going to be my ulna. And then the joint you have on the outside, just in here, that you can see through the ligament here, is going to be your radius and your humerus coming down to meet, and it's going to be the outside or the lateral compartment of your elbow joint. And that joint can move to flexion and it can move to extension, and you can see the articular surface coming through here. And it's supported and limited by three main ligaments here. So on the outside here, you can see this ligament that runs down here. It's going to be almost between those two screws. It's going to be your lateral collateral ligament on the outside of your elbow. So on me, that ligament is pretty much going to be going down there. And it's going to prevent any force getting pushed to my elbow this way. It's going to prevent my elbow joint gapping too much here. So it's going to prevent any force going this way, and it's going to prevent my elbow from snapping this way. The next one you have is to support your radial head. You've got an annular ligament that comes across here, and then you've got one that comes forwards diagonally here called your radial ligament. And those two help your radial head. That helps the lateral part of your elbow. It's a common place to get injuries, and the most common position or injury that everyone can think of is tennis elbow. And you don't need to play tennis to get tennis elbow. Sometimes it can be your ligaments, it can be your radial head, it can be tendons from some of your muscles, it can be a whole host of things around that area. Like we discussed in the wrist, pain here doesn't always mean one thing. You've got 4 or 5 different factors that you need someone to differentiate between and find out your cause of pain to then specifically treat it. So if you've got any questions about your elbow pain, or anyone else's, send them on our Facebook page and by message or call us, and we'll be delighted to chat to you. So speak to you soon, and keep an eye out for our information video tomorrow all about elbows.